Greetings, everyone. This is Noah Washington coming to you from the Atlanta Voice here in Atlanta, Georgia, and welcome to Paging Dr. Jones. Today, we'll be discussing health insurance benefits and what we all need to know. Our guests today are from Anthem Blue Cross and Blue Shield of Georgia. We have Dr. David Jones. Good to see you again, man.
Good to see you.
And Chief Medical Officer, and Michael Triplett, Strategic Sales Consultant. Gentlemen, how are we doing today?
Great. Thank you, Noah. It's a pleasure. Appreciate you having us.
No problem. Dr. Jones, how are you doing today, sir?
I'm doing wonderful, thank you. Thanks for having us again.
So, Mike, you mind if I start with you, sir?
Sure.
So, can you explain why understanding health insurance is so important?
So, Noah, that's really a $4 trillion question when you think about it, when you consider how much we're spending on healthcare in this country today. As a percentage, about 18% of our total gross domestic product is going toward healthcare and healthcare services. So that's almost a fifth of our total economic output as a country. Simultaneously, we see some of the highest prevalence of medical debt in this country to the tune of about $90 billion, and that impacts tens of millions of people. And we know that not only does that have a negative financial impact on a person, your credit score, but typically when you have medical debt, you delay your care. And so you're not getting more care because you're worried about the money you owe for care you've already received. And so it puts you in a less optimal health position. So I think financially, that's what makes insurance relevant to most of us and creates the need. Now, beyond just the financial aspect, Noah, the goal is to improve quality of life and improve and promote health with health insurance. And so typically your insurance plan provides you access to a vast network of providers. These are the providers that are doing your annual exams, your preventative services, your immunizations, and taking care of you when you have a hospitalization or need prescription drugs. And networks are important in health insurance. They're sort of the backbone of the industry. They really reinforce the concept of choice, which resonates in our country, whether you're at the grocery store, depending on trying to pick out which groceries you're going to get. You're at Best Buy trying to figure out what TV you want. I mean, choice really resonates with people. So those networks as part of your health plan are important. And then I'd say just additionally, beyond just the four walls of your doctor's office, there's so much more that comes in your health insurance plan. I think most insurance companies are engaging with their members with a digital-first mindset. So, get to know your insurance application. Things like lifestyle and preventative programs exist in there. You can connect, see, and chat with a doctor. You can access rewards that many times you have through your insurance. So it's really there's more there than just benefit plan design and benefits that way. And I'll just give a quick example. At Anthem, we have an app, our Sydney Health app. Today, we've got about 18 million members using that app on a daily basis. And last year, we had over 500,000 members have a telehealth visit, see a doctor through the app itself. So it's really become our members' first way of engaging with their health plan. And just a personal example, Noah, I just became a father. My wife is currently breastfeeding, and we wanted to reach out to a lactation consultant for some help there. And rather than being subject to scheduling or paying a little extra to have somebody come in our home, both my wife and I are millennials. We've got laptops, we've got iPhones, and I was able to connect with the lactation consultant in under an hour through the Sydney Health app. So all that to say, insurance is important because it's the vehicle toward your better health and a better quality of life overall.
I want to, if we can get a little deeper into that, and can you please explain the difference between HMO, PPO, and POS plans, and what in-network and out-of-network mean?
Yeah, of course. So, you're thinking about networks. I mentioned that a second ago, how important those are to the health insurance space. So a network is doctors, facilities, hospitals that have a contracted agreement with an insurance company to see that insurance company's members, those patients, at an agreed upon rate. If you don't have a network and a schedule of reimbursement, you as the insured are typically liable for up to 100% of billed charges from a hospital, from a doctor's visit, and generally in our country that's unaffordable for most people. So having access within a network and staying in the network just delivers the best outcome from a cost perspective for the insured. If you want to get into the traits of the different networks, HMO, PPO, point of service, the names themselves aren't necessarily relevant, but it's sort of the traits of each of those networks. So, HMOs have been around for a long time. They go back as long as health insurance goes back to the 1930s or so, and more formally they were introduced in 1973. But they're a popular option today. They're really popular in the individual space because they tend to be lower in cost than a PPO or a POS. So individuals can afford those plans more frequently. But the traits about an HMO is you've got in-network access only. There is no out-of-network providers. Typically in an HMO, you're selecting a primary care provider that serves as your gatekeeper, your quarterback into additional levels of care. And third, piggybacking off that primary care physician point, to get to that next level of care, whether it's a specialist or otherwise, you need a referral from your primary care provider. A PPO, it came later, probably in the 1980s or so, but it's the exact opposite of an HMO. You've got in and out of network coverage. You're not required to select a primary care provider, and you're not required to have a referral before you go to a specialist. PPOs today are by and large the most common network arrangement that we see, specifically in employer-sponsored insurance, which employers are collectively the largest buyers of insurance. And then you've got the third, a point of service. You've even got more, but a POS network is really intended conceptually to be a hybrid between an HMO and a PPO. You have in and out of network coverage like a PPO, but similar to an HMO, you may be required to select a primary care physician or see your primary care physician before getting to a specialist. So carriers administer point of service plans differently. But it was intended to be a hybrid between the two. And like I said, network is one of the things we really pride ourselves on at Anthem. Today we've got about 2 million doctors and hospitals that are contracted in our network, over 98% of facilities nationally. And so, back to choice, providing choice to members. That's why we're able to serve almost 47 million Americans nationally, and about half of folks that get insurance here in Georgia are insured through Anthem because of that breadth and the scope of those providers they can access. So those are really the characteristics of those networks. But depending on where you're accessing insurance, will determine what networks and plan designs are available to you.
I want to bring this back around to you, Dr. Jones. How does the coverage connect with healthcare delivery between a doctor and a patient?
Certainly. So first of all, Mike, thanks for sharing all those great details and insights, because those are really key fundamental aspects of healthcare and health insurance. I think we all should know if we're establishing our career or near retirement or early in our career or growing or starting a family like you are. I think it's really important for everybody to know some of those foundational pieces to it. Now, we talked about the coverage, and so I think it's important for all of us to also understand there's very close relationship functionally between the coverage, the care delivery, as well as the cost of healthcare. So they're really all intertwined. I think it's really important that we all understand how they work together functionally. So we take the coverage that Mike just explained about, and then when I say care delivery, I talk about, as a clinician, that really is the doctor seeing the patient, establishing a care plan or a treatment plan, And usually that's where it starts. And then the health insurance or health benefits and coverage really should be an extension or an enabler of those care plans, really, to enable the members to have access to those whatever services the provider recommends for their treatment plan. And as clinicians, we see patients in different capacities. We see them for preventive visits, obviously well visits, and the treatment plans involve maintaining good health and preventive measures and so forth. And that's where a lot of the health plan benefits are that really enable maintaining a good health. And then there's also, we see them for sick visits or acute visits, and the treatment plans to treat that issue and get back to good health. Also involves medications, various things like that, examples. So health insurance benefits really cover all of those and many more. And I think we've talked about before, I think it's important to reiterate that 70% of our health is impacted by things outside of the healthcare system. So a lot of those treatment plans either happen through the health system or outside of the health system as well. And we see patients maybe once every, sometimes once a year, sometimes twice a year, sometimes 4 times a year. But there's a lot that happens in between those visits, and so it's important that people understand how to access the care that is directed by their provider, and or what are the resources and benefits we have that can be an extension of that. And so I can share, I guess, a personal example. I think that may highlight and sort of bring that to life a little bit. In spring of 2024, had a shoulder injury, rotator cuff injury, and I saw my primary care provider, and then saw an orthopedic specialist, and then got some imaging done, and started physical therapy and some anti-inflammatories, things like that to treat it. And then about maybe a month after that, I received a call outreach from an Anthem health advocate. She kind of introduced herself, what her role is, and it was a really great experience because she really talked about those aspects, about the coverage, the benefits, about the care delivery aspects, and also some advice around cost management. So with the coverage piece, she kind of covered some aspects as it relates to the physical therapy and other services specific for the shoulder issue I was managing. And she touched on multiple other benefits I had as an Anthem member that I didn't know the degree of how rich they were. And also, they weren't necessarily related to the shoulder, but the point was I'm now aware of what is out there if I ever need it. And so I think that's half the battle for many people, realizing, hey, these are the benefits that come with insurance, and these are the things I have access to. And it's really a lot more than most people realize. And I think that's one important thing to share. And then from the care delivery aspect, talk through, make sure I'd answer any questions I had about the medication and or upcoming appointments, and making sure those are scheduled in a timely way, things like that. And also, she informed me of other resources or options that may be reimbursable through the healthcare coverage that I have as well, that I may not have been aware of as well. So again, I think that's a way that really those 3 things really are connected together. And the more we're aware of those aspects and how they relate to each other, I think our access to healthcare would be more informed. I think a lot easier, a lot more timely, and hopefully a lot more cost effective for all of us.
Let's get into that.
Sure.
So we've discussed coverage. We've discussed care delivery. Let's talk about the costs of healthcare. Mm-hmm. Open question for either of you.
Sure. So thinking about the cost of healthcare, from an insured perspective, what you're on the hook for. So as you approach open enrollment, as you're trying to select a plan design, you're going to be evaluating plans based on certain characteristics like premiums, deductibles, copays, coinsurance, out-of-pocket maximums. Just a level set for the folks watching at home. First things first, your premium, what you're paying for the insurance. That's your monthly. I think of it as a subscription fee. That's what you're paying to the insurance company for that coverage. Think of your phone, internet, utilities bills that you're paying on a monthly basis. That provides you the coverage to the insurance. As you look at those plan designs based on that premium, you'll see those plans are different based on the deductibles, copays, and such. Deductibles are where most people's eyes go first. The deductible is your portion of covered healthcare services before the insurance starts to pay. And so there's a dynamic where, a lower deductible is typically going to garner a higher premium because you're paying less out of your pocket before the insurance company, and vice versa. A higher deductible typically would garner a lower premium. And so once you've met your deductible, you pay either fixed or variable costs that are a portion of your overall expenses. So a copay is a fixed portion of your expenses. It's a flat fee. So typically for an office visit, you're paying $25 to $30. That's all you owe for that visit. Coinsurance, on the other hand, is variable, and it's typically expressed as a percentage. So rather than the flat $25 to $30 for that office visit, you may owe 10, 20% for that visit. So in some cases, that copay can be higher than the coinsurance would be, and vice versa. Coinsurance in many instances can be more than a copay. So these are the basic mechanics of a plan design. And then, everybody loves the out-of-pocket maximum because once you've hit it, the insurance company pays for everything 100%. And so, typically your out-of-pocket maximum is set a bit higher than your deductible. And once you've reached that, drugs, pharmacy services, inpatient hospitalizations, all your care is taken care of by the insurance company. So your out-of-pocket maximum is something to understand in your plan design as well, because that's your all-in investment in that health plan. And again, a lower out-of-pocket maximum typically is going to drive a higher premium, whereas a higher out-of-pocket maximum, a lower premium. So I think those are some of the things folks have to, as they're going into open enrollment season, considering the myriad of plan options that there are, and many of us are eligible for tons of different plan design options, are some of the things you need to look out for in that plan design. So you've got a line of sight into what your healthcare costs are.
I want to know, what advice or practical tips do you want to give to our viewers who may not be as familiar with this process?
Sure, I'll start. Yeah, so I think just some of the things that Mike touched on. I think basic understanding some core elements of our coverage, our plan type we have, the deductible, coinsurance, things like that, premiums. Those, I think, if we can all at least have a good foundation of what those are for us and how that impacts us, I think that's a really important thing to do. Other piece, we talked a little bit about in-network. I think it's really important to emphasize that we, as much as we can, maximize utilization of our in-network. I think it really facilitates the access to care in a more timely way, a lot smoother all around. So don't, just really, as much as we can, the network access, and the fact that we, as we mentioned earlier, such a large network adequacy should be enough for people to be able to access care wherever they need it, whenever they need it. And then the third area also I think is important is around the understanding what benefits are out there, particularly as it relates to if we get benefits through employer groups. We work with a lot of different large employers or employers of different sizes around wellness programs that they have, really helping to enhance those and expand those, and also health incentive programs that some employer groups, many do offer. I think some of those are underutilized as well. So I think the point is there's so many different options out there, so many benefits that go unknown and or underutilized. So if we can arm ourselves with that information, it'd be really helpful.
Yeah, those are great, Dr. Jones. And I would just add to that, right now where we're at, December 2nd today, it's an important time of year. It's annual individual open enrollment that runs through January 15th. And with that, I think consumers should be aware of, first, what plans they're eligible for. Everybody's eligible for individual plans, but the lion's share of people in this country access health insurance through employer-sponsored plans. Of the 300 million or so people insured in our country, about 160 million are insured through employer-sponsored plans. There's only about 14 to 15 million folks today in the individual market. The excess is over in Medicare and Medicaid, but understanding which you're eligible for, typically with an employer-sponsored plan, the employer is picking up a large portion of that premium and the cost for that health plan. And so many times it could be more affordable than what you can find out there on your own on the individual exchange or through some other plan offering. The second I would say is for seniors aging into Medicare. Folks are working longer now than ever. Many folks are working past 65, and so you get to a point where you're eligible for Medicare, where you're still eligible for your employer-sponsored plan, and you're eligible for individual. And understanding sort of the requirements around Medicare, if you aren't going to take traditional Medicare, making sure that you've got a Medicare Advantage plan with a credible Part D drug coverage. So a lot to think about for seniors this time of year. Something I just experienced, having a new child, you've got dependents you've got to add on to the plan. And that can take place during open enrollment or through what's called a qualifying life event. And so even if you're outside of open enrollment, if you've got new dependents, you've got new children, maybe you've just gotten married and you have a spouse that needs to get on the plan, you can take care of that either during open enrollment or afterwards. And the last thing I would say is just to Dr. Jones's point is, thinking about staying healthy, there's a lot of emphasis in preventive care services. Getting your flu shots, getting your age-appropriate screenings, your colorectal cancer screenings, mammograms, things like that are important. Many times they're at no cost to you because they're preventive as required by the ACA and laws in our country. But when folks are taking care of those preventive services, getting those checkups, they're seeing a healthcare professional more frequently. They've got a better baseline for their sense of health, and they're managing their health more effectively. And so they're not getting to those less optimal health outcomes later down the road that tend to be more costly, emergency room visits, inpatient hospitalizations. And so everybody should be taking advantage of their preventive care services, and many insurance companies are offering rewards and incentives to members for doing those things. So just something to evaluate in your plan. Many times you can be rewarded for doing health activities that many of us should be doing anyway. So just my thoughts on some things people should be aware of this time of year.
Amazing. A lot of great information that was distilled here today, given to our audience. I want to leave us with a fun fact. We're all Virginia boys.
We are. We are. Born
Absolutely
and raised.
insane.
Yeah.
Absolutely insane. So I want to thank you all for joining us here, and we look forward to seeing you guys next time.